Hi, I'm Dr. Alagammai from Gleneagles, Kota, Kinabalu, Sabah. Today we're going to discuss about abnormal vaginal bleeding. What is abnormal vaginal bleeding? Very simple. Anything out of your normal menses is abnormal vaginal bleeding. Well, the most common question I get is, how common is it? Does it happen all the time? Well, it's quite common. Most of us during the reproductive age group, I would say about 40% have it. So that's very, very common. So don't get worried if you have abnormal vaginal bleeding. Let's go to the causes. Causes can be variable. Alright, let's look into the uterus. This is a model of a uterus. Okay, when you look into it, there are various parts. The bleeding can happen from anywhere. First, from the vagina. Any injury at the vagina. I've got people who come to me after sexual intercourse and they have got bleeding, and probably it's just an injury, very simple, that can be done then and there. So it can be from your vagina. The next thing that we're actually looking at is at the cervix, which is very common. Cervix, we call it as pintu rahim. Okay, so over there, what happens? You can have very commonly infection. People just get scared. If I have bleeding, is it cancer growing in me? No, that is not the most commonest, but yes, it is a possibility. So let's look into it. What is more common? Definitely infection. That's number one. The second one that we are looking into is, of course, cancer cervix. Polyps can also happen there. Next thing is the uterus. When we look into the uterus, you're looking into the endometrium. This is the inside of the womb. What can happen? You can have polyps, you can have fibroids, you can have thickening of the endometrium, meaning you can have endometrial pathology. So that means you can have cancer of the endometrium too. So all this need to be seen. Number three, it can be from the ovaries, which is the kilat telur. So if you actually have a cyst, that hormone can influence the uterus and cause bleeding to happen. These are the most common. Of course, you have got other things that causes bleeding, but that is beyond discussion for the moment. So let's just stick to the uterus and ovaries for now. People get scared to see a doctor. They're very worried. If I come with bleeding, are they going to cut me? No, that is not our first thing that we do. So when you usually come, say we suspect that it's from vagina or from cervix, usually we do a speculum. That is the one that you all see with a duck mouth, which most people don't like it, but we use a smaller size here in Gleneagles, so it is painless actually. So when we do that, we can see what is at the cervix. And we can also do a pap smear at the same setting. Ladies, please remember your pap smears is every year. It's not 10 years once, yeah? It's every year. So the next thing that we can do is we need to look into the uterus. So what do we do? A very simple ultrasound. Ultrasound can be from above, that is from your tummy, or we can also do it from below, that is transvaginal. So for transvaginal, sometimes we see it much clearer. But don't worry, if you're a virgin, I'm not going to put it in there, okay? If we're going to look into the uterus and ultrasound doesn't show me things, we will actually suggest you to do a hysteroscopy. A hysteroscopy is whereby we take the camera in and we put it through the vagina. It's very, very small, yeah? It is only about 2.7 mm. We take it, we put it through the cervix, and we go in and we look into the whole cavity, and we can also take a biopsy from there. So that will tell us tremendous lots of things. So that will help us in our diagnosis. And it is totally painless. We do it under anesthesia. So we'll know what the cause is. Well, as I told you just now, when we put in a hysteroscope, that itself can be a treatment because we can actually do a lot of things in there. Smaller fibroids, we can even take out from inside there. So it just goes through your vagina, no cuts in your abdomen. The next thing nowadays that we do is actually the laser surgery. We just put in either 2 or 3 pots. It's just as big as your pen, that's it. In fact, sometimes we don't even suture that area. So we put it in and we take out your cyst or your fibroid, even your uterus if we have to. We can actually do it that way, and we remove the uterus from below. So there is no scar on the abdomen. Well, the outcome definitely depends on the diagnosis. And for diagnosis, you definitely have to go and see a doctor. That is very important. Please do not wait with abdominal vaginal bleeding, saying that it's normal, or taking traditional medications which may have other effects on you. So it is good to see a doctor so as your complaints and you can be treated much earlier.